Mr. President, every day I receive messages from Michigan families who are struggling to cope with rising costs for the things they depend on. We know that it has been challenging in a global pandemic with supply chains broken down and consolidation. But we also know that from food prices to household necessities to gas, corporate price gouging is also taking a big chunk out of Michigan wallets. And perhaps no industry has been price gouging longer, actually for decades, more deeply than the pharmaceutical industry. Americans pay the highest prices in the world for prescription drugs, highest prices in the world, even though we are the ones that have invested so much partnering with the industry on new types of medications, new innovations. We allow research and development tax credits to be able to help pay for that cost. We support other efforts. National Institute of Health helps to pay for the basic research, hundreds of billions of dollars working with the industry. And yet we have the highest prices in the world, highest prices in the world. And 1 in 4 Americans can't afford the medications they depend on, which is just not acceptable. It's just not acceptable. A senior with complex medical needs pays an average of more than $6,000 a year on prescription drugs. And the median price for a new prescription drug is $188,000 a year. That's 90 times the median price for a new drug just back in 2008. And that's more than most Americans earn in 3 years, not just 1 year, but in 3 years. Christina of Centerline, Michigan knows this. She was prescribed Humira for an autoimmune condition that affects her eyes. Unfortunately, even though she needs it, she can't afford it. The medication costs more than $6,000 a month. A month. She wrote this: autoimmune patients struggle with the cost of prescriptions being so high, and some just give up, don't even bother. That should never be an option, in my opinion, she says. James, who lives in Manistee, suffers from narcolepsy. It's a neurological condition in which patients can suddenly fall asleep during other activities, including eating or driving. I'm sure we've all known someone or seen someone who has this disease. James first started taking a medication called Xyrem in 2015. Back then, it cost about $9,000 a month. Today, that same medication costs more than $18,000 a month. $18,000 a month, or $226,221.84 a year, Mr. President. Who can do that? Who can do that? Last year, James' doctor switched him to a slightly different drug with less sodium, produced by the same company, Jazz Pharmaceuticals. The new drug, Xywav, costs even more. $239,000, $239,320 to be specific, per year. James writes, who is profiting from these huge price hikes? Will these huge price hikes continue every year? Does Jazz Pharmaceuticals have enough oversight? Are they putting profits over people? I think there's an answer to that. It sure seems like that to me, James. There is no fundamental reason for these prices to be going up and up and up. You know, Mr. President, when I think about insulin, which has tripled in price in the last decade or so, this is a drug that was actually discovered 100 years ago. 100 years ago by 2 Canadian doctors who developed this patent for life-saving medicine. And because they felt it was unethical to actually be making a profit off of something that would help people, they gave it to the University of Toronto for the equivalent of $1. That was 100 years ago. It hasn't substantially changed as a product in 100 years. They've certainly companies more than recovered their research and development, their costs, and so on. And yet, in the last number of years, the price has tripled. Tripled. That's not a sign of price gouging. I don't know what is. From 2000 to 2018, big pharmaceutical companies raked in $11.5 trillion in revenue. That's trillion dollars. Between 2016 and 2020, drug companies spent $577 billion on stock buybacks, not lowering prices, but doing more for their CEOs and doing more for their stockholders. $577 billion on stock buybacks, about 10 times as much as they spent on research and development. They also, and significantly, increased executive compensation, while Americans struggled to afford life-saving medications. For the record, the CEO of Jazz Pharmaceuticals made more than $16 million in total compensation last year. Awful lot of Michigan families could live a good life on that one salary. The pharmaceutical and health products industry spent $353 million on lobbying in 2021, nearly double the spending of the second highest industry. In fact, at one point, Mr. President, I haven't done this recently, but at one point I looked at the number of lobbyists per senator, and it was 15 lobbyists in the drug companies for every one senator. And so we wonder, well, what's going on here? And then we see what happens in elections and so on, and unfortunately our colleagues on the other side of the aisle who receive a lot of the benefits of the contributions from the pharmaceutical industry then come to the floor and try to block us from doing something and on behalf of people to lower these prices. And that's going to be what's happening again next week. So far, in 2022, pharmaceutical companies have already raised the price of 1,186 drugs, and they've raised the price on 100 drugs just right now in July, this month. 100 drugs. Prices have gone up just this year. It's appalling. There's no other word for it. And while Republican colleagues are fighting to protect these absurd profits, Senate Democrats are fighting for people who need their medicine, in some cases, to just survive, to live, or to be able to go to work, to be able to do what they need to do to support their children to get what they need. Our common sense plan, which we'll be voting on next week to lower drug prices, would save $288 billion over the next 10 years. First, it would empower Medicare to negotiate prescription drug prices, beginning with 10 of the highest costing drugs starting next year. I can't believe we negotiate everything else. And we know the VA that negotiates on behalf of veterans on prescription drugs pays about 40% less. Common sense tells you that we should be negotiating these prices. But unfortunately, years ago, when the prescription drug bill, Part D, passed in Medicare, the drug companies were successful in getting specific language in that says you can't negotiate with them. Medicare cannot negotiate. Well, that needs to change. And we're going to change that. So it'd be 10 of the highest costing drugs next year. That would expand to 20 drugs in each year after that by 2029. Just imagine how much money could be saved if Medicare was allowed to negotiate. And it would directly benefit people who are living with conditions including asthma, a blood clot, COPD, as well as cancers, as well as a whole range of things, everything you can imagine. Secondly, our legislation caps Medicare beneficiaries' out-of-pocket costs for seniors, for people with disabilities on Medicare. We will cap the costs, the out-of-pocket costs to $2,000 a year and allow people to spread that out over the year so that it's easier to make that payment. So instead of $6,000 a month or $9,000 a month or $10,000 a month or whatever, we're talking about a cap of $2,000 you could spread out over the year in out-of-pocket costs for seniors and people with disabilities. Never again will a diagnosis like cancer mean $10,000 or more for a single drug to treat it. Medicare beneficiaries would also receive free vaccines, including vaccine for shingles. That currently costs seniors $190 if they aren't enrolled in Medicare Part D. It would increase help for low-income seniors, giving all qualifying Medicare beneficiaries the full low-income subsidy under Medicare Part D. So we'd help low-income seniors even more. That would save the average senior about $5,000. It's a lot of money. And it would keep Part D premiums in Medicare affordable for seniors and people with disabilities, ensuring that premiums won't increase because of bad actions by drug companies. And that means not faster than inflation. Speaking of bad actions by drug companies, it would penalize them for outrageous price increases. If they go above inflation, they're going to have to rebate those funds. Today, drug companies are incentivized to keep costs high by secretly negotiating with insurers and pharmacy benefit managers to increase profits at the expense of patients. Under our legislation, drug companies, not consumers, will be on the hook for drug price hikes that exceed the rate of inflation. This proposal alone is expected to save Medicare $71 billion. For far too long, the drug companies have been taking advantage of people like Christina and James. People should not have to go without the medicine they need in this country, in America, where we fund through our tax dollars so much of the innovation that creates these drugs. They should not be forced to skip doses or take less than what was prescribed to save money. And they should not have to choose between taking their medicine and keeping the lights on or putting food on the table. Christina and James deserve better. Americans deserve better. And we're going to fight until that gets done. That's what next week is all about on prescription drugs. It's time. It's past time. People deserve to be able to afford the medicine that they need. It's time to put people before profits, Mr. President, and that's exactly what we're going to do.